The thing that makes working at a health center so unique really has to do with the mission of health centers, making sure that everybody gets good health care and that they're entitled to good health care. And so the other part of a health center is that, we're a part of the economic engine of a community. And so as a leader, you know that it's not only about the patient care, but it's about the community care. And some of that is in the form of jobs. Some of that is in the form of development. So that mission really is at the heart of what we do every day.
I just had a patient the other day. She was like, I'm worried because I have a $2,000 water bill and they cut my water off. So the whole conversation changed on a dime. How can we get this lady some help to get her water turned back on? Patients are dealing with things of, food insecurity, transportation, housing, rent assistance. And that's been the basis of what we've done in community health centers, is look not at the patient in a vacuum in an exam room, but at the larger community. And how well you manage that population, that flock, if you will, that you've been entrusted with, is a better measure of clinical excellence.
Looks like everything is doing well.
Yes.
All your cholesterol numbers went down.
It was the hardest decision to stop seeing patients for me. But that feeling that I had that there's something that needs to be fixed out there is what inspired me to go from being a clinician to a clinical leader. But I always think about those faces, I always think about those experiences, and I think about, is what I'm doing today actually helping those patients?
Perfect, one more time.
There are many different members of a care team, all of whom can really make a big difference in improving patient outcomes.
When I visit health centers, I get there early and I just sit in the waiting room. I want to see when the person comes in for a visit, how they're greeted.
Hi.
Because in many ways, that person in the front desk is the representative of the whole organization.
Believing in the members of a care team and empowering them to work at the tops of their licenses is one powerful way in which we can actually help contribute to clinical excellence.
So I didn't start as a nurse. I started actually as a secretary working in a health center. There was an opportunity to pursue a nursing education. A lot of the physicians and nurses at the health center encouraged me to apply. I think I am a homegrown representation of the opportunity there is to grow our staff in health centers, to pursue higher education and become health professionals.
I looked at that model and said, if we can do that, look at how this benefited her and this community and these patients. Let's do it nationally. And ATSU took it, started running with it, and that's where we started with, first with the dental school, and then with the first medical school, and most recently the physician assistant school.
The good thing about having these students come in and train with us is to give them a flavor of what it's like, not in the ivory tower of a medical school situation, not dealing with simulation, but real people with real diseases that need, real solutions.
Leaders set the tone, they set the vision and the mission for an organization. It's not easy.
I think a new clinician leader has to be bold. They have to be willing to work hard. They have to be willing to be humble and be willing to learn.
Well, of course, when I came into this, I didn't know how to be a clinical leader. It's another skill in addition to the practice of medicine. Get out there and find out who can help you, who can mentor you.
Seeing other clinical leaders who are CMOs or who are in the executive seat and talking to them. Finding that person who may have been a few years ahead of you and saying, hey, what were the pitfalls that you ran into? What are some of the advice you would give me? Stress among clinical leaders and even staff at health centers, I think it's definitely at an all-time high right now. And so now our challenge is, well, how do we, as leaders, help with that? Many of us have implemented these wellness programs where we really focus on the employees' state of mind, their happiness, finding that joy.
As clinical leaders, we need to come back to our why to refocus us when we're going through those ups and downs of clinical leadership and to keep us focused. And it always comes back to our patients and the mission of what we're trying to accomplish and fulfilling our calling.
And as leaders, that's a part of what we need to be doing, helping people remember the why and why taking care of patients in our community is so important. It's hard work, it is relentless work, but without us, 31 million people would have less care.